Good morning, dear friends. From today, we are going to discuss some clinical cases. So, welcome to the clinical case studies. And now I have chosen to start with abdomen. In this abdomen, we are going to find different cases. So, all sometimes the symptoms may be similar with other disorders or diseases. So, you need to be very careful in identifying and suspecting the right disorder. And I have to identify all the symptoms carefully. Now, coming to the case one. So the first case is a 21-year-old lady decides to wear jewelry around her umbilicus by pricking the skin. So she went to a local beauty parlor and she has done her pricking the skin around the umbilicus. Now, after 1 week, she has found that there is slight inflammation. She has observed around the umbilicus, and slightly it has become reddish, and we can find the erythema can be seen around the umbilicus. Then after first week, she has found in right and left armpits, she has found some painful swellings she have observed in her armpits, and also she has found right and left groins. Also, she has found swellings in the right and left groins. Now, can you explain these swellings in anatomical terms? Let us focus on that symptoms. Now, what is the answer for that? So, we have seen the patient and she is complaining that she went to the local beauty parlor and done her umbilicus piercing. So, we need to concentrate on that particular area and we need to know the anatomy of that particular area. So when you try to see the lymphatic drainage of the umbilicus, above the umbilicus and below the umbilicus. So above the umbilicus, the lymph is drained into axillary lymph nodes. Below the umbilicus, the lymph is drained into superficial inguinal group of lymph nodes. Let us see that. Now in this picture, we can clearly see that above the umbilicus, the lymph is drained into the anterior axillary lymph nodes. Below the umbilicus, the lymph is drained into this superficial inguinal group of lymph nodes. Now, this is the axillary lymph nodes, and here you can see the superficial inguinal group of lymph nodes. Now, because of infected needle has been used for the piercing of umbilicus, that caused the inflammation around the umbilicus, and also after 1 week, she has found the enlargement, painful enlargement in the right and left armpits that is caused by inflammation of anterior axillary group of lymph nodes got swollen. Then why the groin also got painful swellings? Because of superficial inguinal group of lymph nodes got swollen. So that is the answer for the redness around the umbilicus and the inflammation in armpits and in the groins. Thank you. See you soon with a new case.